bananas and are persuasive.
Norma Disick was an elderly woman living at Elmcroft La Mesa, a senior living and memory care facility. She was a patient with dementia who would often act out with violence towards other patients, according to the San Diego Union Tribune. She was attacked on February 20th by a fellow dementia patient who was known to be aggressive. She was found beaten in the fetal position on the floor the day of the altercation, while her attacker was found in the room next to hers, naked, yelling, and crawling on the ground. Disick had blood-filled contusions on both sides of her head, according to the later autopsy, but she was released back from the care of Elmcroft without any x-rays. In the care of hospice, they found Disick had an MRSA infection, 2 rib fractures, and a collapsed left lung. Disick died on March 8, 2015, ultimately due to multiple blunt force injuries, a homicide. Sadly, this is not just one horrific incident. In fact, assisted living facilities across the country are haunted by similarly troubling events. Patients in assisted living facilities are at risk all over the world. There simply aren't proper laws and regulations that go far enough to protect our loved ones. We need to change that today. Thus, I am here to convey that assisted living facilities need stricter regulations and more trained staff. Today, we will examine the problems, causes, and solutions to this elder care crisis. Let's begin by examining the problems in these facilities. In many facilities, patients are given the wrong medication and are unprotected against violence and bullying from fellow patients and untrained staff members. According to an article by the New York Times entitled "Poor Patient Care at Many Nursing Homes Despite Stricter Oversight," staff often neglect to tell families about patient injuries. This is unacceptable. How can these be care facilities when our loved ones are clearly being mistreated? It should not be legal to make patients helpless when we are paying and trusting these facilities to help and care for them. Due to outbursts from patients and illnesses such as dementia, patients can be agitated and violent. These facilities are known to control and treat their patients with sedatives and antipsychotics, with no reference to their current medications. According to a 2019 policy report published by the California State Legislature, care providers should have training in areas that include assistance with daily living, hygiene and self-care, signs of illness and disease, and knowledge of medication and emergency procedures. Facilities for those with serious medical conditions should be subject to different regulations than board and care facilities. However, many times this training is insufficient or non-existent. This leads staff to overprescribe sedatives that are potentially harmful. This again is improper care that our elders don't deserve. Nurses and staff need to be well trained and have the ability to check for other symptoms such as UTIs or constipation to determine why the patient would be uncomfortable. This would eliminate the use of sedatives for the wrong reasons. An emphasis on properly trained staff would be a benefit for patients being wrongfully treated. Today, I'm prepared to provide you with ways to change these regulations, but first I want to introduce you to the troubling causes that allow these conditions to exist. So next, let's examine the underlying causes. There are 2 key factors: a lack of regulations and structural reliance on subpar facilities to provide care. First, there are limited regulations. The San Diego Tribune states that current regulation for on-call or on-premises staff members to patients is 1 to 15. Now, this does not state that the staff member even has to be awake. They just have to be on call and around if needed. This does not show hands-on care. The regulation also states that if there are 16 to 100 patients, then there needs to be 1 staff member awake and another staff member on call within 10 minutes away. Again, how can these facilities ensure that are caring for their patients consistently with such low numbers of staff? With little to no laws regarding staff requirements, the U.S. Department of Health and Human Services suggests that families look into the type of training the staff receives and how often they do this training. It is currently different for every facility. Second, despite these poor regulations, many families must rely on these facilities. Caring for an elderly family member is noble, but often it is simply not feasible. Caregivers often have high levels of stress and will feel drained and hopeless due to lack of progress. The caregiver's self-care often suffers too. They no longer have the time to prepare themselves proper meals or exercise. The Family Care Alliance states that 6 in 10 caregivers reported their self-care habits worse than before. Additionally, there seems to be a gender split. The burden of caregiving is put on the daughter 2 times more than sons. They are given unrealistic expectations. Along with self-care, they lose on wages and time with their kids and spouse. A 2018 EW research report gives us the statistics that parents also caring for a loved one spend 67 minutes more caregiving and 86 minutes less doing paid work than non-caregiving parents. Adults and parents providing care most often become stressed, sad, frustrated, and exhausted. It is not a secret why. Caring for an elder is just as time-consuming and hard as caring for a newborn. Family caregivers also are more at risk for frequent headaches, back problems, depression, anxiety, and anxiety disorders. Because of the difficulty of caregiving, many families must rely on facilities that do not provide sufficient care. Despite these significant challenges, we can take clear action to move forward. Let me tell you how we can solve this serious issue. As an individual, you can take it upon yourself to check up on your elders when placed into these facilities. With a higher family presence, the facility will feel more inclined to accommodate and help you. Be persistent. This is your loved one's life after all. Ask questions about the facility's policies on care, staff ratio, and family awareness. Make known that you are your loved one's advocate and will be their voice when they need assistance. On a larger level, you can contact your local congressperson and urge them to address the following bills. First, Assembly Bill 2044 regarding staffing requirements will require one administrator to be present 24/7, employment and scheduling of a sufficient amount of staff members, and require 10 hours of training within the first 4 weeks, then 4 hours annually after. The bill would also require training in fire and evacuation emergencies. The next Assembly Bill is 2171 regarding residents' bills of rights. The bill would allow residents to the right to dignity from staff, personal privacy, medical treatments, care, and confidentiality of their records. These rights would have to be written out and copied for the resident and the resident's advisor by a staff member at the time of admission. The final bill I want to give you increases the requirements of training and staff members. Senate Bill 911 would require a minimum of 80 hours of classroom instruction and 60 hours of in-person instruction. It would also require the completion of a test that would have at least 100 questions. So today we explored the horrific living conditions in U.S. assisted living facilities. We looked at the problems, causes, and solutions to this crisis. It's clear that assisted living facilities need stricter regulations and trained staff. I implore you to act so stories like Norma Disick's become a lot more rare. Norma and her family experienced a trauma that no one should have to endure. Our elders deserve to feel safe and be cared for. It is our responsibility to look out for the ones who looked out for us.
The machine needs jams. Sorry, 1 second.
I broke the camera there. Sorry. Makes me feel great.
Yeah, I love technology sometimes.